sudden cardiac death. Maybe sometimes it's a good thing, and most of the time it's a bad thing. I guess when my time comes, I just don't want to wake up and just pass away peacefully at home. But I don't want that to happen a long time. So we're going to explore, what happens about potentially for dying, rhythm problems, and different. What happens to us at sometime at the end of life, and maybe we'll talk about bring life back as well. So tell us what we learned today.
Yeah, thank you for that intro, Dr. Curnew. So today we're going to be talking about sudden cardiac death, as Dr. Curnew mentioned. So if you want to go on to the next slide. So first we're going to talk about what is sudden cardiac arrest and what are some of the signs and symptoms for this disease. Let me go on. So sudden cardiac arrest occurs suddenly and often without warning. And it happens when an electrical malfunction in the heart causes an irregular heartbeat, otherwise known as an arrhythmia. Typically, in the healthy heart, electrical signals control the rate and rhythm of the heartbeat. Faulty or extra electrical signals can make the heart beat too fast, too slowly, or in uncoordinated way. Changes like these are called arrhythmias, and while some arrhythmias are brief and harmless, others can lead to sudden cardiac arrest. When the pumping action of the heart is disrupted by the electrical malfunction, oxygen cannot be delivered through the blood to the brain, lungs, and other organs. And because of the lack of oxygen to your cells, sudden cardiac arrest can turn fatal in just minutes, and survival odds are often best only when help is immediate. Unfortunately, this condition occurs more often than you would think. Sudden cardiac death is the largest cause of natural death in the United States, and it causes about 325,000 adult deaths in the nation each year. In fact, it's responsible for half of all heart-related disease deaths. In Canada, that number is more around 35,000 cardiac deaths, and the vast majority do happen in public places or at home, and only few people survive. So on the next slide, you may see what are some common signs and symptoms. Well, in more than half of these cases, sudden cardiac arrest happens with no prior symptoms. When symptoms do occur, they often include fainting or losing consciousness, a racing heartbeat, dizziness, lightheadedness, chest pain, shortness of breath, or feeling sick to your stomach and throwing up. Upon onset of cardiac arrest, you might notice that you suddenly collapse, you might lose your pulse, you can stop breathing, or lose your consciousness as well. So you might be wondering, on the next slide, what exactly is the difference between sudden cardiac arrest and heart attack? Well, people often use the term interchangeably, but they're not the same. A heart attack is when blood flow to the heart is blocked, while sudden cardiac arrest is when the heart malfunctions and suddenly stops beating. Hence, you can think of the heart attack as a circulation problem and sudden cardiac arrest as an electrical problem. To go a bit more into detail, heart attacks occur when a blocked artery prevents oxygen-rich blood from reaching a section of the heart. If the blocked artery is not reopened quickly, the part of the heart that normally is nourished by that artery begins to die, and the longer a person goes without treatment, the greater the damage will be. In sudden cardiac death, a heart's electrical system itself malfunctions and suddenly becomes irregular. The heart starts beating dangerously fast, and the ventricles may flutter or quiver, otherwise known as a ventricular fibrillation. While these two terms are not the same, they are in fact linked. Sudden cardiac arrest can occur after a heart attack or during recovery, and heart attacks, in fact, increase the risk for sudden cardiac arrest. Many heart attacks don't immediately lead to a sudden cardiac arrest, but when cardiac arrest occurs, heart attack is a common cause for it to occur. Other heart conditions may also disrupt the heart's rhythm and lead to sudden cardiac arrest, and these include things such as a thickened heart muscle, otherwise known as a cardiomyopathy, heart failure, arrhythmias, and ventricular fibrillation. So, as the next slide shows, you might be wondering, who does this primarily affect? It occurs most frequently in adults ranging from mid-30s to mid-40s, and the condition itself is quite rare in children, only affecting about 1 to 2 per every 100,000 children each year. Moreover, this affects men twice as much as it affects women, and you're typically at a higher risk if you are of African American descent. Certain genetic predispositions and conditions, such as hypertrophic cardiomyopathy, which is a thickened heart muscle, can also leave you at increased risk for sudden cardiac death.
So now I'll be going over how it occurs. So sudden cardiac arrest, as mentioned, occurs suddenly and without warning. An individual may experience SCA when there's an electrical malfunction in the heart, which can cause irregular heartbeats known as arrhythmia. So these irregularities come in the form of tachycardias, which are rapid heartbeats, or bradycardias, which are prolonged heartbeats. An example of an arrhythmia pertinent to this discussion is ventricular fibrillation, which is an underlying mechanism related to sudden cardiac deaths where the heartbeat becomes erratic. So in the picture there, you can see that for the bradycardia, there are long rests in between the heartbeats. For the tachycardia, there are very rapid heartbeats. And then for the ventricular fibrillations, there's those erratic squiggles that you can look out for. Next slide. So now I'll be going over some risk factors. So there are many risk factors for SCA, but we've just covered a few here. So definitely family history is extremely important. So history of coronary artery disease or any other heart-related disease is something to look out for. Smoking can increase your risk of SCA. So chemicals in the cigarette smoke form clots inside veins and arteries, which can increase your risk. High blood pressure and cholesterol. The risk is 3 times greater in patients with moderate hypertension. Obesity also affects SCA risk. This is related to the increased requirement of blood to supply oxygen and nutrients, which leads to an increase in blood pressure. Type 2 diabetes, and finally, obstructive sleep apnea. And this is a sleep disorder which involves problems with quality, timing, and amount of sleep. Next slide. So now I'll be going over sudden cardiac arrest cases in young adults. Next. So we know that the risk for SCA increases in older populations, but did you know it also is a leading cause of death among young athletes? So they occur in about 1 in 50,000 to 80,000 athletes annually and are most commonly caused by ventricular fibrillation, as you mentioned. So the rates are still extremely rare, as seen. And now we know that physical activity has great health benefits, no question about that. And exercise has been proven time and time again to reduce all-cause mortality and risk for acute heart attack. So why are the rates so high among a population that should be the healthiest? Well, the paradox of sports is that when people are partaking in extremely vigorous exercises that push their bodies to a limit, this can actually increase their risk for cardiac events by 2 to 3 folds. Now, please keep in mind that this is not to deter you from exercise. And while the term vigorous can differ from person to person, if you are a young athlete, vigorous refers to Olympian level training where you are straining yourself for multiple hours a day. So this shouldn't be something too much to worry about if you are in that situation. Next slide. So most of the cases of SCA in athletes are related to underlying cardiac conditions that go unnoticed because of the perception that all athletes have superior cardiac health. And while this is true to some extent, given that they are able to achieve such great physical feats, this can often lead to underdiagnosis of conditions, especially if they are young. So some of the conditions that they might have are, again, hypertrophic cardiomyopathy, heart rhythm disorders, and blunt chest injuries. So I'll just go over what each of these are. So hypertrophic cardiomyopathy refers to a thickening of the heart muscles, which can make it difficult for it to pump blood. Now, this can be due to hereditary disorders, but can also be due to prolonged periods of training or stress, which can cause permanent changes to the heart structure, like scarring and fibrosis. Heart rhythm disorders mainly refers to disorders that cause fast, erratic heartbeats caused by faulty signaling. SCA is due to blunt chest injuries are common in high contact sports in which the force of banging into other people itself is strong enough to induce ventricular fibrillation. Next slide. So what are some ways to know if I have increased risk? Well, electrocardiograms currently remain the gold standard for SCA screenings, but you can get a variety of tests done to look for specific conditions that might increase your risk. So there are blood tests to help determine if you have a leaky heart, and echocardiograms can let you know if there's a defect in the integrity of your heart structure. And now while screenings are an extremely useful tool to know your risks, it has been proven that screening can reduce risk of cardiac deaths. Athletes often fear having this piece of information on their medical records, because they think that it might prevent them from getting opportunities, scholarships, or training that they need to succeed. And they also worry that there might be a case of overdiagnosis or a false positive that might even prevent them from playing the sport of their choice altogether. Next slide. Now going to prevention and treatment. What are some ways to prevent and treat SCA? But because as stated, SCA are sudden and come without warning, as stated in the name, it's hard to fully prevent and treat when it occurs. However, there are some steps you can take to minimize your risks. So as mentioned, if you have had symptoms in the past or have known family history, you can book regular ECGs and monitor your heart. Again, those are the tests that can be done. I'll list on the slide there: electrocardiograms, echocardiograms, and blood tests. If you know you're at increased risk, for example, you have multiple comorbidities that can contribute to your heart, and you're worried about SCA daily, you can get an ICD inserted, so an implantable cardioverter defibrillator, which will automatically give your heart a shock and reset your signals if there is a life-threatening beat detected. Another way you can prevent SCA is having an AED around. So this stands for automated electrical defibrillator. And it's a portable defibrillator, and the current updated ones that they sell nowadays are extremely advanced, and they have a voice feature that will actually speak to you and let the person that's saving your life, let the person know how to perform CPR, how to set up the device, and when to deliver the shock. Next slide. So some treatments that are available. So definitely if you see someone having SCA, perform CPR right away, call EMS. And if you have an AED beside you, set it up and defibrillate, deliver a shock when needed. There are also some medications that you can take. So you can take antiarrhythmic drugs, which are beta blockers and ACE inhibitors. Avoid smoking and drinking to lower your risks. Maintain a healthy diet. So at our cardiology clinic, we host a cooking club, and that's a great way to get started on maintaining your diet. Try to manage your stress. And again, at the clinic, we host a meditation club. So that's some place you can get started on trying to manage your daily stresses. And as mentioned, exercise is a great way to prevent SCA if done correctly. So build up your routine sequentially by increasing the time and weights incrementally to ensure that you're not stressing your heart too much and too quickly. And remember that cases of SCA among athletes are still really rare. And as long as you're not throwing yourself into a triathlon tomorrow, you'll be fine. And exercise is a great way to just maintain your health overall. Next slide. All right, thank you for listening. Dr. Curnew, I think you're muted.
Thank you so much. Let's just back up one slide here. So that was a very overview of sudden cardiac death. So let's think about this. So sudden collapse. The first thing when someone collapses, you have to recognize the person's not asleep. There's, that they actually dropped dead. We saw an athlete on TV collapse, and the reason he's alive today is that people knew what to do. So first thing it says here, CPR defibrillation. We know that if people have a cardiac rhythm disturbance, which you mentioned ventricular fibrillation, where the heart beats like a bag of worms, or ventricular tachycardia, you can try a cardiac punch that will generate a little bit of electrical impulse to the heart, but more importantly, you need to shock that heart. And you have to prime the heart, and some people too as well. So learning CPR, everybody should learn CPR. And it would be nice if it was part of school agendas. And some people are thinking if you want to graduate from high school, you need to know how to use CPR and learn how to use these automatic defibrillators. As you point out, the automatic defibrillators can talk you into to treatment. You can perform CPR without mouth-to-mouth resuscitation if you want to as well. So first thing is to recognize someone's collapsed, that they're not fall asleep, and just say, Joe, wake up, are you awake? And then you can start off with chest compressions. If you're doing chest compressions, a person's asleep, they'll know pretty quickly and they'll wake up. And so better to over and under treat. I've been involved in a number of cases, and one was actually unfortunately, a performer who collapsed while she was actually singing. They thought it was part of an act, and no one did anything. And the time that was recognized, that was far advanced. Now she was lucky; she survived, but she left with brain damage. Um, and and you mentioned collapse. Collapse could be other things. So another person who collapsed actually had swallowed a sausage, and it was a piece of hot dog that was stuck in their airway and they couldn't breathe. So that has to be recognized, the right situation. Other causes of collapse is that you have a sudden bleed inside your head, for instance, a drug overdose, low blood sugar. So you have to really you have to be astute to this, but when in doubt, start CPR and then start asking questions and alert, call 911, get somebody else to get involved in that situation. One of the things that's very interesting is that someone actually collapsed outside our office building one day. I was walking from the hospital, and I found it very hard to perform what I need to do when someone started a video camera as you're going through your activities. I asked this person, please put your video camera away. It's hard enough to be in these situations, just add stress to that. So if you're involved in an arrest, be helpful. Try to say, what can I do to help? Do I need to call 911? Do you know where the automatic defibrillator is? And so these are important steps that we need to stay calm and relaxed as much as we can. It's not a relaxing situation, but be prepared. Now, there's many causes. You mentioned electrical. You mentioned you can have a structural change to the heart, like hypertrophic cardiomyopathy, a thickened heart muscle, which is a leading cause of passing away in young athletes. There could be like a right ventricular dysplasia. There could be electrical problems, something called prolonged QT syndrome, Wolff-Parkinson-White, Brugada syndrome. Those are things that I've been spending my last 30 years of my life trying to figure out. But you as an individual, your job is to recognize that something's gone wrong, to activate the system 911, start CPR, and if you can learn how to use an automatic defibrillator, use it. And it's very gratifying to save a life. And other more complicated things like blood clots and strokes and things of that nature, or you rupture a big blood vessel and you're bleeding out. Those are things that there's not too much you can really do about that. The other thing too, right now, we have to think about drug overdoses and having Narcan available and things of that nature. Those people may or may not be breathing. So get that, be smart, look at people's pupils and proceedward. So this is a very difficult situation, but it's also a very rewarding situation too as well, because bringing somebody back to life, everybody can save a life, and everybody should learn how to save a life. So I want to thank you for sharing that, and encourage people to those chains of commands. And that's why people should wear medical bracelets. Look for a medical bracelet. If you have a process, I have a defibrillator in place, you should have it on your wrist and things of that nature. You should also have your medication list readily available so someone can find it quickly to know what's going on, because wouldn't it be sad if you were a diabetic and your blood sugar was very low and someone didn't recognize that? And so have a medical alert bracelet and make things available. It's always difficult when people say, I have my list left at home. Don't leave your list left at home. You need to have the list, your list on you and readily available for that period of time when the ambulance comes to the paramedics help and things of that nature. People are trained, but you can be trained too to help the situation. So thank you for sharing some of those thoughts. Daniel, what are some of your thoughts from all this?
Yeah, I think my thoughts is I completely agree that like CPR on sort of the thought that CPR needs to be more, I think, integrated into just what like our general teaching. I don't think I was taught a lick of CPR in high school, unfortunately. I had to go out and seek opportunities. I got involved with a lot of swimming back in the day, a lot of lifeguarding, so I was able to learn CPR that way. But I think if I hadn't, gotten involved with lifeguarding, I would have never been able to, like, I wouldn't know what to do, frankly. And I think it's really a shame that such like a life-saving sort of procedure that can come in handy when it's least expected really um, is something that's I guess not commonly taught, and you have to actually seek out opportunities to learn it versus it's not something that's like fundamentally part of our teachings in our society. So I think it's just a shame really.
Yeah. So recognize the person's unconscious, that you can't arouse them, activate 911. And for CPR, go to the breastbone, press hard and fast. And that's off to a good start. And ask people around for help. And you're on your way there. The automatic defibrillators right now, they'll talk you through this. One of the most important pulses to take is your own pulse. Is that to make sure that you're calm, and I know it's a scary circumstance, but by being as calm as you can make a difference. And learn how to do these sorts of things. It's something that's all very learnable. In fact, every 2 years I get recertified, and in my younger days, cardiac arrests were something that we did in hospital, and we learned a lot. And the first time I did a cardiac arrest where I walked by and someone collapsed on the street, it was a much more stressful place, because in the hospital you have people around you know what to do, you have rhythms, you can put monitors on very quickly, but in the middle of the street it's much less different. But yes, you can make a difference, and keep learning. And also, the best way to treat cardiac or sudden deaths is to prevent it. So we talked about, from drugs to alcohol, to overdoses, and just preventing a heart attack, and knowing your family history. If if you have hypertrophic cardiomyopathy, the gene is present 1 in 500. And if other people have sudden deaths in the family, if you have something called prolonged QT syndrome, there's multiple forms of that, linked to that circumstance. And so these are the things that we talk about. These things are important. Now, sudden death can also be a blessing at times, because at the end of life, people can be suffering with chronic illness, and not waking up, it can be a blessing at times. So when I started off, it can be a blessing. It could be, but we want to learn to deal with these things and to prevent them, and lots of it can be dealt with. And I want to thank the team for presenting this information. Defibrillators are available. If you have any questions, and we can please let us know. We're always available. And my plea to you is, if you're in a situation, call 911. Don't panic. Take your pulse, and try to be helpful and supportive. Even if you know what you're doing, you can certainly support the people around you. And don't take out your camera to take a picture of this. Take out your camera or your cell phone to call 911, and be helpful and be supportive. And pick up clues. Search that person's wallet, see what medication lists, look for bracelets, look for signs if you worry about drug overdoses and things of that nature. And some people have a Narcan kit, and learn how to use these sorts of things. And there's so much you can do. And I want to thank everybody for sharing this. Any thoughts from anybody else? Are there any questions or thoughts from anybody up there? Well, I'm going to play hockey tonight. And you mentioned like don't run a triathlon. Well, I do these mini triathlons, and I don't push myself too hard. I know my limits at this point in time. You mentioned in marathons, people tend to die at marathons at the end of the marathon. They push themselves too hard towards the end. And so know your limits. And if you think you have, and the leading cause of cardiac arrest is coronary artery disease, having a heart attack or a scar in the heart, a fatal rhythm, and that can be prevented and treated. 80% of heart disease is preventable from cholesterol, blood pressure, weight, smoking. Know your numbers. And if you have certain medications, you need to know if your potassium is too high or too low. That can cause a rhythm problem. So many things you can do. So take initiative and be healthy and get healthier. Exercise is a great thing for the vast majority of us, and just don't overdo it. I'm the worst hockey player on my team, but I have the most fun on my team. And And for those who want to do those mini triathlons, you can finish last with me and we can have some fun doing it. So we'll cross the finish line together and not overdo it, but have some fun learning. So I want to thank the team for a wonderful presentation. Thank you so much, everybody. Have a great night.
Night, everyone.